is Dr. Shrikant. I'm one of the senior consultant hematologists. I'm attached to the Center for Hematological Disease at Kilpauk, which is attached to the KPV clinic. I'm a qualified hematologist for the last 30 years and have an immense experience in treating both benign hematology and hemato-oncology as well. So most of us would wonder what hematology is. It's basically a condition where we treat the blood diseases from simple conditions such as low hemoglobin, for example, like anemia, low platelets like thrombocytopenia, and also people who have white cell problems, which is low, leading to infections. We also treat patients with blood clots like deep venous thrombosis, pulmonary embolism, where you have a blood clot in your legs or lungs. The other conditions we treat are like ITP, when your platelet count goes very low and you might have bleeding. We also treat children with hemophilia and adults with hemophilia disorders and bleeding tendencies as well. Now on the malignant front, we treat multiple myeloma, which is cancer of the bone marrow, and also we treat leukemias. Most of the leukemias are either acute or chronic, and we treat both types of leukemias, and also we treat lymphomas, which is a tumor of the lymph glands as well. Now in our center, we have a comprehensive daycare unit which has around 5 beds as well as 7 sofa chairs as well. This enables us to give chemotherapy, immunotherapy, as well as targeted therapy to the patients. Now the advantage of a center is we have an on-site laboratory which houses a comprehensive hematology, biochemistry, coagulation facility as well. Now the advantage of our lab is we have a fully automated hematology analyzer which will give us the readings within 10 to 15 minutes approximately. So when a patient comes, we examine, we get the blood test done, and within 15 minutes we are able to give you the blood reports, especially the hematology and the coagulation part. Now the other thing with regards to the laboratory aspect is we do also have facilities to report the blood films and diagnose the blood diseases, and also we have facility to do the bone marrow test as outpatient and also to report them. Our turnaround time is pretty quick compared to other standalone laboratories as well as other standalone centers, because we one-stop comprehensive center where we see the patient, do the test, and also we are able to do the bone marrow and diagnose these conditions. Today I'm going to talk about multiple myeloma, which is actually cancer of the bone marrow. Now myeloma commonly affects males. It is affecting the age group between 65 to 75. It's the second most common hematological cancer. So what is myeloma? Myeloma means there is some protein producing cancer cells, what we call as plasma cells, which are present in the bone marrow. Now this goes and affect your calcium salts, it can affect your kidneys, it can damage your bones as well, and it can knock down your immune system as well, giving rise to infection. So who can get myeloma? Now there is a familial tendency of around 3 to 5%. So that means if one of your immediate family member is affected, then there's a 3 to 5%. So you can contact your doctor or hematologist and get the test done to rule out the possibility. The second thing is people who had various infections such as viral infection, hepatitis, HIV are also prone. And patients who have been exposed to radiation, benzene are also prone to developing this multiple myeloma. So what are the signs and symptoms of multiple myeloma? Myeloma damages your bones, so you could have bone pain, you could have fracture, it can damage your kidneys, renal impairment where you will get swelling of your legs. It can cause anemia, so you will get tiredness, weakness, and you can get recurrent infections, and sometimes you can get bleeding as well when your platelet count goes down. Now, how is myeloma diagnosed? We do blood tests, bone marrow tests, and a PET CT to see which all part of the body is affected. So what all treatments are available, and what have we done so far in the last 30 years? Now treatment now is mainly targeted where we have protein breaking medicines, what we call as proteasome inhibitors, which are given as an outpatient setting, and also we have immunomodulators where we give its oral based regime, and we have even now immunotherapy which we are giving as outpatient. Now the latest addition to this armamentarium is your BITE antibodies, and now CAR T cell therapy is also being increasingly used in the Western world. So myeloma, initially in the 80s we thought patients live for 3 to 5 years, but now we can easily say most of them live for almost 15 years. Thank you.